And I did a little research last night before I talked with you, and it sounds like that is something that the CAPTIVATE trial is investigating. The patient asked about that, what that trial is, and it's music to my ears as a cancer patient to hear something like fixed duration. It's also investigating a fixed duration, so patients can have maybe a bit of a medication vacation. So can you speak to that trial a little bit and explain what it is a little bit and how that might benefit patients with CLL?
Yeah, so one of the best elements of treating with venetoclax is that it produces a deep level of remission in many patients. In fact, when given with the monoclonal antibody obinutuzumab to CLL patients receiving that treatment as a first line of therapy for their CLL, about 3/4 of CLL patients will get to so deep of a remission that we call them minimal residual disease negative. And that's a blood test or a bone marrow test, but more easily done as a blood test, where we can look to a sensitivity of 1 in 10,000 white cells and determine if there's any CLL in those 10,000 cells. And if we can actually go deeper than that, but we call patients negative if they're less than 1 in 10,000. And so 75% of patients will get to that depth of remission just with obinutuzumab for 6 months, along with venetoclax for a year. So when researchers saw that, they recognized that we could probably stop treatment, in those patients getting venetoclax, because venetoclax yields these deep responses. And then the next kind of thought was, well, could we give a BTK inhibitor with venetoclax, but also over a defined treatment timeline, and maybe get some of the remarkable benefits of treating with a BTK inhibitor, but not get stuck being on therapy for years and years. So the CAPTIVATE study was the first really to, in a large phase 2 manner, look at that combination in a younger patient population. It was for patients 70 and younger, and it wasn't in a high risk or anything. It was all comers, but they did have to be 70 and younger and getting treatment as a first line therapy. So the combination was very effective. As of the last American Society of Hematology meeting in December, like 4 years of data was reported, and a large percentage of patients were still free of progression, over 80% still free of progression. And that's 3 years off therapy at that point. It was well tolerated. Not many patients had to come off due to toxicity. It was in fact less than 10% had really significant toxicities requiring discontinuation. So it was a well-tolerated, effective treatment. I do have one of those studies open at my institution, the acalabrutinib venetoclax combination. It's called the MAJIC trial, and it is a large phase 3 study that, if it's successful, I think would lead to the approval of giving those two drugs together. But then the extra credit question is who should get the combination and who should get the drugs separately, and we don't have an answer for that right now, and that's a long topic of debate among CLL specialists.
Great. Well, thank you. So for that trial you spoke of that you're conducting right now, is it only relapsed patients who are eligible for that, or is that for frontline therapy?
This is the first line therapy study. Yeah, the MAJIC study is.
Oh, good. That's promising for patients too.
And it has a really good comparator arm, so that won't be a problem. The standard arm on that study is venetoclax plus obinutuzumab, so it's comparing against one of our best treatments, and so we really will get the answer of does it look better to use the BTK with the BCL2, or is it not really that much better than just giving venetoclax with obinutuzumab? And then the one obvious element that I didn't mention that would be nice for most patients, in addition to being efficacious and well tolerated, is if you could get an all oral combination. Of course, venetoclax with obinutuzumab, you're still getting quite a few infusions with the obinutuzumab over the first 6 months. So that's a lot of time in the infusion center that you could avoid with just the combination of two oral targeted agents. So that would be a breakthrough for patients too, I think.